Hey guys, how are you? Dr.C at Aloha Orthodontics. Today we're going to go over everything about Invisalign. Got a little cool nifty handout here. When you guys come in, you'll get one of these sheets. It'll go over everything you need to know about Invisalign. So Invisalign is a fantastic technology. It works just like braces, and over a series of trays you'll get straight teeth. And what happens is the movement is built into each tray and it works just like braces. And every tray that you wear, it'll slowly get your teeth straighter and straighter and straighter. At the end of this series of trays, you have really nice teeth, just like when you get braces, okay? So number one thing with Invisalign, you want to make sure you're wearing them at least 20 to 22 hours a day. If you don't wear them at least the 22 hours, you're not going to get the movement that you wish. So the biggest thing with Invisalign, it has to be in your mouth long enough, and that's how it moves just like braces. So we want to make sure we're wearing the trays at least 22 hours. Now, the one awesome thing about Invisalign, there are times where life happens, and if it's really tough to wear it on a particular, during a particular time, you can stay on that tray longer. Wait until you can wear that tray 20 to 22 hours for at least a week, and then move up. So that's, the general guidelines for it. Every orthodontist has her own way of how often you should switch it and how long you should wear it. So definitely follow your orthodontist recommendations. At Aloha Orthodontics, that orthodontist is this guy. All right, so that's the first step. So placement and removal. Invisalign, to remove the tray, what you want to do, and I don't know if you can get a close-up on this, is you want to pinch the tray at the very bottom, and you want to move it towards your cheeks. And when you do that, it generally will be easy to tease the tray off to the other side. So that's how you do it. When you put it on, you line up the trays, the front teeth with the front teeth. The top trays and the top teeth are always bigger than the bottom teeth. So that's how you know the top tray from the bottom. And you push it in on the back. If it's not fitting perfect, you have to push it gently in. You don't want to put a lot of pressure, otherwise it will bend. So you want to use gentle pressure, and it should glide right in. When you get your trays, if that's a problem, definitely let your technician know or let the doctor know, and we can take a look at it for you and help you troubleshoot. And if you ever are at home in between trays and you're switching trays and a new tray doesn't fit right, the awesome part about Invisalign, you can stay on your last tray, give us a call to come in, and then bring your trays with you and we can troubleshoot together for the next tray. So this way you never have to worry about teeth moving backwards. And that's another thing that you want to do with Invisalign. Always save at least your last 3 trays. If you're wearing them regularly and you have any trays that don't fit, you can at least go back to the last one, and that'll at least give you a backup plan, okay? Now, on some of the treatments, we will use little tooth-colored attachments, and I don't even know if you can catch this when you zoom in, but there are little tooth-colored attachments that we use on certain teeth. Now, these are tooth-colored, so they're pretty hard to see, so your friends won't know that you have them, but they help us with the movement, and sometimes they do help us with the retention, which is how well the trays fit to the teeth. All right, so don't stress it at all if any of them fall off. The nice part is the 3-dimensional coverage of Invisalign will ensure that a majority of the movement takes place, but the attachments do give us a little bit more control. Now, the nice part is if you ever have an attachment fall off, it's not an emergency at all. Just give us a call, and when it's comfortable for you to come in, we can always look at putting it back on. For some patients, we can actually wait until the next appointment, and if we need to place it, we can. If the trays fit well 3-dimensionally to all of the teeth, then the movement is still working for what we need it to do, okay? The next step is storage. So when you first get your Invisalign, you'll get 2 nifty cases, and they're pretty cool. So you'll get 2 trays, and what we want to do is you always want to wear your current tray in your mouth. When it's not in your mouth and when you're eating or brushing your teeth, you can put it in a case. And when you get to the next tray, you can always put your old tray in another case. So this way you always have your most recent tray that you switched out of in one case, and you have your current tray in the other case. So this way, if anything ever happens, you have that last tray readily available for you to put that on. Let's see. So cleaning the liners. So your Invisalign trays, you want to make sure that you're brushing, flossing after any meals so that the food doesn't get stuck in between your teeth. If you have any food that's stuck in your teeth and you try to push the Invisaligns in, it can sometimes smear across the teeth, and that can sometimes cause problems. It also can cause pain if you have any food stuck in between your teeth and you try to push the trays against it. So for that reason, it's a good idea always to brush, floss after every meal. If that's unrealistic during lunchtime or you have a busy schedule, that's okay. Just rinse vigorously with water, and at your earliest time that you're available to do so, then you can brush, floss. But at the very minimum, every morning and night, and in between, if you rinse vigorously and there's no food stuck in between the teeth, you should be okay. Now to clean the trays, you can just rinse it in lukewarm water. You can use a toothbrush and brush the trays. There also we have products like Retainer Bright, and this is a cool little retainer cleaner, and they have a lot of similar products for clear trays to clean them. You can put Retainer Bright in a cup for about 15 minutes, and that will help it, stay antibacterial and clean, and you can rinse it off. If sometimes you want to give it a fresh taste and you want to rinse it in some Listerine and water, that's okay also. All right? Now, with Invisalign, when you first wear them, it's not uncommon to talk a little different, so don't stress it at all. The biggest thing is you have to get used to it like anything else that's new in your body, so your tongue needs time to get used to it. So the best thing to do when you first get your Invisalign trays, call a best friend, talk to him or her for hours and catch up. You can always call your mom, and I'm sure she'll find a way to talk to you for hours, and that will be a great way to get your tongue used to it, and you'll talk normal within a few hours of talking regularly. And if you have any issues with the trays cutting the tongue or anything, definitely that's something that you can come in and we can help you troubleshoot on. Lost trays, generally when you lose a tray with Invisalign, the best thing to do is always make sure you call the orthodontist, and he or she will guide you. If you have a handful of trays with you and you've worn your trays for at least a few days and you lose an Invisalign tray, you definitely can consider going to the next tray up, provided there is nothing out of the ordinary with your teeth and you don't have short roots or any other medical conditions or dental conditions that would make this a problem. You can wear the next tray, and if everything fits well, wear that tray longer and get in touch with your orthodontist and make sure that they get a chance to check it out before you continue moving on your tray sequence. All right? Dental visits with Invisalign, the fantastic thing about it is you can brush, floss just like your regular teeth. You take the trays off and brush, floss like you normally do. With your dental cleanings, you want to maintain your visits with your dentist. So whatever he or she recommends every 4 to 6 months. Maintain your visits when you go in. When you do go in, if you have any fillings, this is another nice little trick to have for your dental visits. If they have any fillings that you need to get done, what you can do is bring your trays with you to all your dental visits, because if you have any fillings, there's a good chance that your dentist can use the trays to mold the fillings to fit your Invisalign trays. So this way you can still keep using your Invisalign trays and your treatment can still progress. All right? Another trick about that, when you have any dental treatment, try to set that dental visit on a day that your orthodontist is open. So this way, if there is any problems with the tray fitting, you can always call the orthodontist and he or she can kind of help guide you as well. All right? So while we're on this topic, I'm also going to freestyle a little bit and see if there's anything else that comes to mind. If the trays are ever pushing against the gums or cutting your lips or anywhere that's uncomfortable, you guys can take a clean nail file and file down any areas that are really sharp. So that's definitely an option. It's always a great idea to make sure you call your orthodontist first and get the approval from him or her prior to doing it. But a safe thing to do is if it's anything that's super sharp, if anything doesn't fit right with a new tray, the best thing to do is wear the last tray that fit well and wait to come in for us to troubleshoot together. If the tray is bothering you and you don't have the last tray, then you can consider filing just very little with a clean nail file until it's smooth for your comfort, and then wear that tray and then come in. And always keep your orthodontist in the loop when you have any, situations like that. Oh, hey guys, you're here still. Great. So, a couple more things about Invisalign. So, some other things that you can use to troubleshoot with this video. If the aligner ever gets cracked or torn, it's not a problem at all. Generally, you want to follow the same protocol as a loss retainer. If you've worn the Invisalign tray for at least a few days full time, the 22 hours, and you're comfortable going to the next tray and it fits well, you can definitely do that. Some aligners, if you're on your last aligner and it's cracked anywhere, if it still fits well, it's 100% okay to wear it until you can come in, as long as it's not cutting you or causing any unideal movement. And once you come in, we can help you troubleshoot from there. Sometimes the trays can be bent, so if you accidentally bend the tray and it's not fitting well, always take a look on the inside of the tray, and if there's any areas that are bent, you can actually use your fingers to push the bend out and then gently put it on your teeth on that side first so you don't rebend it, and then you should be okay. Now, if you're on your last tray and sometimes the tray splits into two pieces and that's your last tray, call your orthodontist, set an appointment to come in and see him or her soon, and still continue wearing the trays in two pieces. If you have any concern about swallowing it at night or anything, you can bypass the nighttime wear and still wear it during the day full time in the two pieces until you can comfortably come in. If it's in much smaller pieces, we don't want you wearing it in 5 different pieces. Then at that point, if you have your last Invisalign tray, go to that tray and then give your orthodontist a call and then come in and we can troubleshoot from there. Nose extractions, okay. Ready? Alright guys, so some Invisalign trays will have certain attachments that are on the inside of the trays that help with your bite correction. These are not true attachments, they're just little extensions in the tray, so it just feels odd when you're biting. Don't stress that at all, it's just part of the bite process and it just helps with the treatment, so there's nothing for you to worry about. If you have any concerns, you can always take a picture and text or message your orthodontist and they can always take a look at it. Now, outside of that, there are some Invisalign trays where we do use rubber bands with the trays. Now, those hooks sometimes can also bend out and cut your cheeks. On those, you just bend the hook back and you can put it back in your tooth and that should help out. If there's ever an issue with that elastic hook where the bend is out towards your cheeks and you can't bend it back, double check with your orthodontist and you can always clip that hook for that tray and then go into your orthodontist for them to help you troubleshoot. So that should be everything that we need to know about Invisalign. One last thing that just came to mind, sometimes with the treatment you may have extractions done. If you get teeth removed, that area for the first few hours where you get the teeth removed may be bleeding and may be a little swollen. So for that reason, you can avoid wearing the trays for the first few hours until the blood clot forms. Once the blood clot forms, if everything is healthy and you're comfortable wearing the trays, you can go back to wearing the trays and you should be perfectly fine. It's not uncommon for during that period to get some blood on the trays, so just make sure you do a selfie check so you don't look too scary and scare your best friend or anything like that, and you'll be in great shape. Okay? Outside of that, that pretty much sums up a majority of your Invisalign experience. If you need anything at all, give us a call at Aloha Orthodontics, www.aloha-braces.com. Find us on Facebook, message me, and we'll take care of you, okay? Have a great day, you guys.